Good evening, everyone. Thank you so much for joining us. We are excited to have you here. I am Meredith Ritchie. I'm the Director of Communications at the Colorado Coalition for the Homeless. And tonight you have joined us to talk about alternatives to homelessness, innovative solutions that work. And we have some very exciting guests tonight that I am very excited to have you all hear from. This is a pretty tight agenda, so I want to keep us to our time frame. And I just want to go over a few features with you before we get started. The first thing you'll notice is at the bottom of your screen, you'll see that you can either do two things. You can chat or you can ask a Q&A. Q&As go directly to panelists. Chat goes to anyone else in the room. So if you want to talk amongst yourselves, have some brilliant ideas you want to share, have some exciting energy you want to push out, that's the place to do that. The Q&A is where you can ask questions directly to our panelists, who we will have about 10 minutes at the end of this one for them to answer those questions. So without further ado, here's who we have coming in. I'm going to, in just a brief moment, introduce you to Jenna Salerno. She does our street medicine program and is a nurse with us at the Colorado Coalition for the Homeless. Following her, we'll have Cole Chandler and Dave Newhousel, who will talk about the Colorado Village Collaborative and the safe outdoor space that they've created. Following them will be Kimberly Braun, who's the Director of Development from Hope of Longmont. She'll be talking about safe outdoor parking. And then Robin Wood Mason, who's the Director of Development and Communications with the Dolores Project, to talk about 24-hour access of care. All of these projects are so exciting and they're happening in our state, and that's good news. I spent some of the afternoon looking up innovations throughout the country, and so many of them pointed to places outside of the United States. There's all these cool things that happen in Europe, and we need some more hype about the cool things that are happening right here in our backyard. So I am pleased to introduce Jenna to you, and then I'm going to stop sharing my screen so she can go ahead and share hers, and I'll let her take it away.
Thank you so much, Meredith, and thank you all for sharing this opportunity to speak with me. It's one of my, I probably shouldn't have favorites, but it's one of my favorite programs. I really love street medicine and health outreach. I think it's the heart and soul of serving and being and walking alongside of people experiencing homelessness. I just want to get a thumbs up if you all can see my PowerPoint.
Yes, we can, Jenna.
Okay, great, thanks. So I just wanted to start out. Health Outreach is a team of individuals who have various clinical experiences or non-clinical experiences to serve the health of clients, unsheltered clients on the streets, in their cars and tents, etc. Another term for clients experiencing homelessness, unsheltered, is rough sleepers. So you might hear that as well. And this is just a picture of this past weekend in sub-zero temperatures, two of our nurses out talking about frostbite, doing education and getting supplies needed over the weekend. And so what this health service delivery model looks like and why is it important, I'm going to talk about now. So kind of the 5 W's: who, what, when, where, why. What is this all about? We are trying to meet the needs of underserved community members and populations. We're really trying to strive for equitable delivery of healthcare services. And that means immediately, right? When clients are ready. It's figuratively and literally meeting clients where they're at, with their needs and trying to provide dignity and quality in those services. So different models across the country. It can be any number of skilled healthcare services. It can be physically face-to-face. It can be via telehealth, and just walking alongside them in their healthcare journey. The street medicine health outreach philosophy is really reducing barriers to care. Trying to stop that cycle of homelessness and meet the unique needs of different populations for past experiences with trauma, poor experiences with healthcare systems, or any other unique situations they may have that might be barriers to healthcare. So this may be familiar to you. Just some brief statistics of people experiencing homelessness. Who are we serving? Colorado does have a large population of clients experiencing homelessness. These are some statistics from the point in time survey last year. We always think that these are probably unrepresented numbers. And then you can see some of those individuals. And then next page, are unsheltered. So these are who we are outreaching for these street medicine health outreach, and really targeting these individuals to support them as they have really low access to care in our traditional healthcare model delivery systems in the United States. So international models, national models, local models, people are doing this in all forms in all different kinds of countries, depending on the needs of that community or population, whether it's rural or city-based. We see that we have lots of different laws and policies and guidelines that even vary from county to county within our own state that might affect change and how we might deliver healthcare. And so we've even seen some transitions on how our health outreach has had to morph and change over the COVID response this past year, or as we've, had to deal with camping bans that maybe other cities don't have, and how that might, or even with the, different encampment, reaching out to them and the stability of the population, and whether we can do follow-up care with clients living out on the streets. And so different models of care really try to adjust for those needs and populations, and different policies and procedures. So at CCH locally, our health outreach program is growing. In 2002, we did have the health outreach program was in a more traditional health outreach model via the van, the HOP, it's lovingly known, big giant bus. It goes around to different locations in the community. It still does that, but there was still a population of individuals that weren't having those needs met. Clients still had to come up to the van. They still had to go there. And so we're trying to go to the clients, go out on the streets, try to reduce as much barriers as possible. And so we did a pilot in 2018 with a nurse, behavioral health provider, and outreach worker. And we went out, did a community assessment, saw what clients' goals were, their top 3 goals were medical care, counseling, dental care. The acuity of the clients that we saw varied vastly, but the majority did need an office visit sometime between 3 days and 2 weeks. So if we were able to meet those healthcare needs of the clients, we might be preventing hospitalizations, really engaging clients when they're ready for those healthcare delivery needs, which was really cool. Some barriers for that traditional model system, why we're out in the health outreach in general, is leaving their belongings, fearing that they might lose their belongings, transportation to the clinic, feeling like they might leave someone behind that they care about, that they're watching over, anxiety about going into the healthcare system, anxiety about past experiences, anxiety maybe about the location. They have maybe some past trauma in that location. And so different interests, whether they're engaging on a one-on-one conversation or would be willing to have a telehealth visit. People were really interested in that. Sorry, when we recommend office visits to streets, I do see a question in here. We do refer to all different healthcare organizations. Not all clients experiencing homelessness that we're health outreaching are CCH clients. So if they want to be a part of CCH, we absolutely refer them to all of our integrated healthcare services. If they are an MHCD client or a Denver Health client, any kind of engagement we can connect them to is our goal. Our goal is the client's goals. So when we're talking about what people need, some myths are that people do have access and they just don't want access. They don't want healthcare. And the reality is there's lots of different experiences people experiencing homelessness have, and barriers I addressed before as well to going into this. Some outcomes that we see and just going alongside the journey, right? Some of this philosophy of healthcare is we're human focused, we're human forward. Every human deserves healthcare and deserves people to care about their humanity. And so we want to be able to reach them wherever they are in that journey. I might not be ready to, implement a 5-day exercise program right now, but maybe I can take 10 minutes once a week, and that's where I am right now. And so I think we all have our little mini journeys. And so it's just, it's that, but in the extreme, because they don't have basic needs met. Their food, shelter, safety, etc. Some outcomes we see is absolutely reduced morbidity and mortality, better quality of life, less chance of severe illness, less chance of hospitalization, engagement of safety, engagement in the community and other resources. We have a success story, even I didn't know even Cole was coming, but some clients that we've been doing health outreach with that have then engaged with some of our safe outdoor spaces and are able to be found and able to talk or able to be engaged in our protective action programs, supportive housing, more interested and trustworthy because we're building those relationships and showing people we really care and we want to take care of them and be there with them along their journey.
Hey, Jenna, sorry to interrupt
Yeah.
you, but I think your slide is stuck on the why. I don't know if you were trying to pull up more there, but it's just blank in the myths versus fact and outcome.
Yeah, thanks. Okay. I just was kind of talking for some bullets. I'm lost in my mouse, so. And so translating models of care, I think for healthcare for the homeless and for health outreach is, yes, it's an innovative program. Yes, it's not a traditional healthcare delivery model. This patient needs care. They have to book a visit. They have to call in. They have to go in there. There's all of these steps and systems and waiting and inefficiencies and scary steps or access to resources or communication that our clients out on the streets may not have. And that way it's innovative, but in the innovation of public health or community health or where, I'm a nurse, so where nurses were rooted, we're in the community and circling back to that and going towards clients or even our home healthcare delivery systems that we have now. That street corner is just that client's home, right? That tent is that client's home for a moment. It's not a good one. All humans deserve a better home, but that's their home for now. And so how can we bring the health to their home if they have, a barrier of coming in? So that's a huge part of health outreach. And then we can try to relate and engage and offer more services as needed. I think I've just got one more minute. And so I just want to say that this is really changing. We're expanding. We're hoping to go further, expand. We are expanding out in our community, expanding our programs. And we just think that we've seen success stories our nurses have brought back, our outreach workers have brought back, our behavioral health navigator, that team of people has brought back huge success stories of clients that hadn't talked or accessed services in dozens of years that are in the cycle, for the first time getting access to, getting clean, getting substance use treatments, accessing housing. Some of the barriers we have is finding those clients again, especially in a city where we have the camping bans and are moving people all of the time. It's really, really difficult to have that continuity of care and care plan to be alongside someone in the journey if we can't find them to deliver their medications the next day. So that's a barrier we're continuously addressing. But our clients are amazing. I'm so honored to have them have shared stories with me when I've been out. And my team when they've been out, and it's been a real honor to do this, and I'm excited for what the future has to hold. So thanks for listening, and your advocacy is on anyone needing healthcare is really important.
Thank you. Thanks so much, Jenna. Excuse me. We really appreciate you chatting with us about that. And now we're going to move on to Cole and Dave, who are going to co-present on safe outdoor space. And just so you reminder that if you have questions, please feel free to put them in the Q&A. We will get to as many of those as we can for our panelists. Again, feel free to chat in the chat amongst yourselves. And we will be checking both to help anyone who might need any assistance and guidance throughout the process. And then Cole and Dave, take it away.
All right, thanks so much. I'm Cole Chandler. I'm Executive Director of Colorado Village Collaborative, and I'll let Dave introduce himself as well.
Yeah, my name is Dave Newhousel. I'm a pastor at Denver Community Church, and we are a host site for the safe outdoor space that Cole's going to be presenting on.
Cool. So I'll just go through a few slides, and Dave will jump in and provide some stories as well. So just first off, to just talk about what a safe outdoor space is. You may have heard this term, and you may not know what we're talking about when we're talking about a safe outdoor space. So this is a model that was designed specifically to be a response to COVID-19. So as the COVID-19 pandemic set on about a year ago in Denver, there were significant efforts made to make sure that people had access to spaces indoors early on as part of the pandemic response. We expanded hotels across the city. There were auxiliary shelters that were opened. But we noticed that there were more and more people that were staying outside. The 2019 point in time count compared to the 2020 point in time count showed that the numbers of people on the streets had doubled in the city and county of Denver alone. And that was pre-COVID. So there were more and more people sleeping outside, and we were trying to find something that we could do to benefit the folks and provide high quality of service to folks that were staying outdoors. So that process involved talking with people on the streets. It involved talking with advocates. It involved talking with service providers and neighborhoods to understand what could we do to deliver a higher quality of service to people that were sleeping outdoors. And so this model emerged. It's a 24-hour staffed, managed campsite model where people have access to services and resources, the kinds that you can see outlined on this space, but it's intended to be a resource and service-rich managed encampment site. So there are 2 sites that are currently in operation, and we're really pleased that last night Denver City Council passed a contract through that will fund a 3rd site at a site to be determined later this year. But this site that is operated by the Colorado Village Collaborative is at Denver Community Church, where Dave is the pastor. Dave, I wonder if you would just say a word about sort of the context surrounding the church prior to us opening our site.
Yeah. So one of our buildings, the building that we're talking about, the building in question, is at 16th and Pearl, or a block off Colfax, right in the Uptown neighborhood, just up the road from the Capitol. And if you're familiar with that area of downtown Denver, homelessness has been an issue, and folks experiencing homelessness, it's a huge concentration within the metro area and has been an issue in the neighborhood for decades. So we're kind of in ground zero. And as Cole was talking about the realities of the pandemic, interestingly enough, we had been in discussion with Colorado Village Collaborative about the possibility of being a host site, as they were looking for willing property owners for this. And so interestingly, at that time, there had been a lot of encampments. If you're familiar with the neighborhood over the last 6 months or last year, really, a lot of informal encampments have popped up throughout the Capitol neighborhood. And so it just turns out that just before we went public on our choice to be the host for this outdoor space, an encampment popped up across the street from our church, and so building. And so there was about 60 people or so, kind of a fluid community of an encampment in a parking lot across the road from our church. And so it was just really emblematic of the fact of it was so visceral of the need, especially as we were approaching the colder weather time in the midst of the pandemic, and just seeing it so viscerally to see, 60 or more folks that were living and all the difficulties that experiencing homelessness brings right in front of our building. And so it was it worked in our favor in some ways as a living example of what we're trying to help and solve. And conversely, it was hard because that made our conversations with our neighbors all the more difficult.
Yeah, absolutely. So around the middle of December, we opened up 30 brand new individualized ice shelters there. I'll show you what those look like here in a moment. But that site has capacity for 40 people. That camp that Dave mentioned, we were able to locate 32 people from that camp directly into our site the day that we opened it. And then we actually helped locate about 5 people from that site into the site that was operated at First Baptist Church of Denver as well. So really, that was an incredible opportunity to utilize a different technique than what the city traditionally does in their sweeps to find a way to locate people into services. Outreach workers would probably tell you there's hardly ever a day that they would go into a large encampment and locate nearly 70% of the encampment into services in one day. But that's part of what we were able to do in that context that was really exciting. So just moving forward, one of the things that we had to solve for in getting this up and running was, how do you permit it? And so we found a pathway through Denver's zoning code utilizing a temporary unlisted use permit. If anybody has questions about that, I can provide more information as follow-up, but won't spend too much time here. When we're thinking about what the purposes of this site is, there's three primary purposes that I like to identify, and they're shared here on the screen. First and foremost, we're trying to prevent the spread of COVID-19 for people that are unhoused. People that are unhoused don't have a place to go to the bathroom. They don't have a place to wash their hands. They don't have access to all the kinds of things that you need to be safe during a pandemic. And so this was an effort to do that. We do daily symptom screening at this site, and we do monthly surveillance testing. And so far, we're pleased that we have a 0% positive testing rate at our site. Additionally, we're focusing to extend resources and services to people that may not otherwise have those. And so Jenna shared about the ability that outreach medical teams have had to be able to find their clients and find their folks that they're serving on the streets because they're staying in our space. And so that's one of the benefits that we're looking to bring, as well as to create long-term links and connections to case management and ongoing housing resources for people as well. And then the final thing is sort of what we were speaking to about the context surrounding the church when we first launched. We're hoping to help relocate people that are in existing unsanctioned encampments into a safe, managed encampment model. And so this is a model that we've learned about from other places. This is not just being done in Denver. It's not just being done in progressive cities. It's being done all across our country in places across the political spectrum. And I think that's important to point out. So we all probably have an idea in our mind of what traditional encampments look like. And I want to just quickly flash some images that show what we're talking about when we're talking about a safe outdoor space. So this is the outside of the safe outdoor space at Denver Community Church. DCC paid to put up this great fence barrier that just wraps the church, or wraps the site with the love that is going on inside of that site. Dave, I don't know if you want to say a word about that project.
No, I mean, just that we had some artists in our community that wanted to beautify the space. And I think that, you know, even before that banner was up, I think, you know, the site is very orderly. It looks like, if anything, it looks like a construction zone with a circus going on inside, like there's circus tents. So like, not a circus of craziness, but really just like it looks there. I mean, there you go. So yeah, I mean, that banner really beautified it. But honestly, the banner is nice, but it's really just a picture, as Cole said, of actually beauty that happens inside, because far beyond the fact that it looks nice and everything's orderly and symmetrical and it's a really clean, beautiful space, we've really been able to create an incredible community that I think otherwise would be hard to achieve with some permanence and with some security and stability in an unsanctioned encampment like the one that was across the street. And that's certainly verified in the ongoing stories we hear from our participants. You know, I try to spend several hours out there several times a week, and the friends that I've made and the stories I hear every day about folks that are making positive choices towards leaving addiction, reconnecting with family members, getting VA benefits, getting their teeth cleaned for the first time in years. It goes on and on and on, but we're seeing just the stability of this community, the connections that are made. I think it soothes trauma for folks who obviously live much of their hours of their life otherwise demonized and tormented and in search and lonely in many ways and cut off. And so we're creating community, we're creating stability, and yeah, it's been really, really great.
Awesome. Thanks, Dave. So hopefully you got a chance to see some of those images. Just to share a little bit about the management model, we've got a slide here that kind of walks through how the management of the site takes place. The residents are expected to uphold some basic guidelines to participate in the space, and that's covered at intake. And we work hard to create buy-in with the residents on those items. But these items were also developed in conversation with people that were staying on the streets, living in camps. We were doing surveying, we were building support for the project. And that support that we've built has created a great deal of support for it. We actually had to cap our wait list at 100 people because there's been so much interest in this site. And the way that we've filled it has been in partnership with outreach workers and with our staff going out to people that are in the existing area and working to bring them in. We're now completely full And like I said, have a long wait list, but we're getting ready to launch an additional project here in the next month or so. So I have one final slide for you, and that's, this is a new and innovative approach. We've been at it for 2 months, but we're seeing some early signs of success that we're really excited about. We've been able to connect some people to tiny homes. We've been able to connect people with housing vouchers. We've been able to connect people with ongoing case management. And we've had that 0% positive testing rate that we're really pleased about. So thank you so much for having me, and I'll pass it back to Meredith.
Thank you. That was great. I appreciate you both, Cole and Dave. Next, we are going to go to Kimberly. I see a ton of questions coming in, so I'm not going to waste anyone's time. I'm just going to let Kimberly get to talking so we can hopefully get to a number of your questions. So Kimberly, without further ado, go for it.
Thank you. Well, it's an honor to be with you all. And let me get my, so I don't have a PowerPoint. I'm stepping in for Joseph, who is under the weather. And so I'm going to be here and you'll get to just see my face. Similar motive, similar sets of resources, similar outcomes, and a complementary model to helping those who are going without homes right now. So comparing and complementing all of you, we started our first Safe Lot program. This is a safe parking program that Hope, that I work with in Longmont, has started right in Longmont. And we're modeling it according to our own template of a full circle approach that we've been working with homeless since 2007. Our inspiration comes from the many counties around the United States who have seen the tremendous need to supply support for people who are reduced to sleeping in their cars. Many people don't realize that the first step to homelessness oftentimes is sleeping in your car. You lose the ability to rent where you're staying, you lose your home. A series of catapulting events plummet you into knowing that at least you've got your car. And it's very, very stressful to be reduced to sleeping in your car. Other people who sleep in their cars are those that have traditional barriers, or barriers to traditional sheltering. So traditional sheltering does not provide a good space for families. It does not provide a space for, in most counties, for those who have pets. And it does not provide a space for those who have extreme PTSD because of the overstimulation of the environment. Many people who are sleeping in their cars have one of those three issues going on, or those three qualities to their life. So we started our safe parking program through a generous grant through a private foundation last year. It opened in June, and we offered all our resources, all the resources you've seen laid out here from the two other speakers. We've offered medical and job assist, housing assistance, and the full range. And all of our first people who slept in that lot have all been rehoused and have employment. So we know what we're doing is working. And since then, we have gotten more funding. We are in the process of opening 2 more lots in Longmont, which will create the first hub model for safe parking in Colorado. We are deeply working with the Colorado Safe Parking Initiative. Even though they're not involved in the lots we're starting, we've been in collaboration with them with lots they've started in other areas in the Denver metro area. And we did receive funding just recently to open our first hub of lots in Boulder. So we're looking probably within the next 4 weeks, we're tying up ends for how we'll provide hot meals in the evening and a few other logistical things. And once that's in place, we'll open those lots. We do an entry process. It's innovative because it's completely a person-to-person type of program. What we're trying to do is keep it where it builds community, keep it where our staff are in direct contact with the people that we're serving. In the evenings, we're at the meals with them. We have overnight shelter managers that are there for anything that may happen that's on the emergency level. And we have people there to send them off with a great breakfast in the morning. So I would say that this idea is not a new idea, as the stats showed for the other programs that you saw prior to this one. It's been happening around the country. But every county has an issue with not providing safe parking for those reduced to sleeping in their cars. And what's most challenging is that those that are needing to sleep in their cars find that they park somewhere and then they get a knock on the window that they have to move their car. So they get a restless night of sleep, which makes it even harder to tend to all the things they need to do during the day to move back into renting or even owning a home. We're there to help them with all the resources, and we're looking towards expanding. We're creating a manual. We were just in USA Today. We're so fortunate. And we are looking to have a manual that any county can take what we've done and apply it. Almost like you have a wedding planner, we'll have a safe lot parking planner that will show you all the steps you need to have in place. So we're working with refining it, and it's important because the need is there. And many times when people are sleeping in their cars, they're extremely isolated. They don't have any sense of community. Their car is the only place that they have any social interaction if they happen to have a partner. So we're creating community. And in that community, we build trust. And with that trust, we break down the narrative around what they're experiencing and what can be the life that they want to create. And we're bringing it out in the community. We're letting the challenges that this unearths be an opportunity for deeper and more complex dialogues with all the other agencies in our community so that we can talk about these difficult issues and get to some of the root causes as to why those that don't want to be sleeping in their cars are sleeping in their cars. So that is it. It's called our Safe Lot Parking Program. We continue to expand. We're going from 1 to 6 or 7 this year, and we're looking on expanding beyond that. And it is a pleasure to be with all of you and to hear of the great work that you're doing. Thank you so much.
Thank you, Kimberly. That was great. It's so great to hear about things that are happening outside of Denver, because I kind of live in a little bubble. So I'm excited that we were able to include you. There are some benefits of all these virtual meetings, right?
Absolutely. Same
Yeah.
here. Same here.
Yeah, right?
Those were awesome.
Perfect. Thank you. So last but not least, certainly we are going to have Robin join us now from the Dolores Project, one of my favorite places. Personally, I am excited to have you join us, Robin, to chat a little bit, and I will let you take it from here.
Of course. Well, thank you, Meredith, for the invitation to join, and good evening, everyone that is watching from home or wherever you happen to be. My name is Robin Wood Mason. I'm the Director of Development and Communications at the Dolores Project. I use he, him pronouns. And given that we're talking about homelessness, it always feels appropriate to start out any conversation we have with a brief land acknowledgement. Just to remind folks that we are in fact living on land that has not always belonged to us, and that we're on land that has been the traditional territory of the Ute, Cheyenne, and Arapaho peoples. And so knowing that we have displaced people in our history, it just feels appropriate to acknowledge that before we keep talking about what we're doing to address the challenges facing people experiencing homelessness right now. So the Dolores Project, we are a shelter and supportive housing provider. We're kind of the small shelter here in Denver. It is a 60-bed facility. We've been open about 20 years now. And a couple of years ago, we were part of a huge project to create a continuum of housing solutions on one site. So we have, sorry, I put these in the wrong order, forgive me. So we are at a site called Arroyo Village. We have our 60-bed shelter with 35 one-bedroom permanent supportive housing apartments. Those are all inhabited by folks who had experienced chronic homelessness. And for our purposes, that means 5 years or more of housing insecurity. Those are a sliding scale in terms of their rent. Minimum monthly rent is $50 a month. And we provide wraparound support services to the folks living there. We're also in a partnership with Rocky Mountain Communities, who is a low-income housing developer here in Denver. And so the rest of our site includes 95 1, 2, and 3-bedroom apartments. Again, all of those are subsidized or rent controlled in some form. So this was the first project of its kind to include a 60-bed shelter, supportive housing, as well as affordable workforce housing. COVID and the arrival of the pandemic presented a huge challenge for all of the shelter providers here in the Denver area. I think it's important to note that we have gone from being largely overnight only shelters to all of us are operating 24 hours a day. And that was a huge challenge and a really quick shift for many of us. But it now means that we're able to provide significantly better support services and access to care for the guests that are staying in our various programs. Following the passage of Proposition 2B in the fall, that created a dedicated revenue stream through sales tax for the city and county of Denver that is committed to providing support for homeless service providers and solutions to housing insecurity. Following that, the Dolores Project is part of the Denver Rehousing Collaborative, which is a super cool program that is led by the Colorado Coalition for the Homeless that has allowed us to rapidly rehouse a lot of people who have experienced homelessness. This kicked off back in November, and for us at the Dolores Project, being a 40-bed shelter during COVID times, we've been able to rehouse 24 of our shelter guests in 14, 15 weeks. And so we're just seeing a huge success because of the availability of new resources. I did see in the questions about resources for folks who are not yet homeless, but experiencing challenges maintaining their housing. And Mile High United Way is the regional operator for the 211 hotline. And I can't speak highly enough of what that offers to our community. They can connect you to rental assistance, substance abuse counseling, pretty much any problem that you're having. They have a way to get you the help you need to reestablish stability in your life. So that is one of the best resources available to people, both here in the Denver metro area and statewide. I think one of the exciting things that's coming along with the Rehousing Collaborative and how that work continues for us at the Dolores Project is that we're not just putting people in apartments and saying good luck. We have a team of case managers, including a specialist who is a peer, someone who has lived experience with homelessness, her entire job is aftercare. So for 1 to 2 years after you've been placed in stable housing, you have a resource with the Dolores Project who will help you navigate any problem. If your washing machine breaks, your dishwasher floods, rather than sort of having a freak out and possibly getting yourself into a bad situation, this is someone who is on call for you and will help you navigate finding the solution to whatever problem you're having. This year, we also added a behavioral health counselor to our staff who is able to do one-on-one and group therapy, both for shelter guests and our supportive housing folks, and just being able to expand, how far our reach is when we talk about wraparound services. So that's been really exciting for us in terms of evolving our shelter. One of the big changes that came from COVID and going 24 hours is that we had previously offered shelter beds for a week at a time, which was longer than most providers anyway. But we are now largely in a place where once you're in with us and have a bed secured, you get to stay with us as long as you need until we're able to find you stable, lasting housing. And so that's allowing us to connect folks with additional counseling, whether it is for addiction or other substance abuse challenges. Our case managers are working through finding you housing, but also if there are mental health. We've had a lot of folks with physical challenges that have come through, and we're able to support them getting medical care. We are also pet friendly. If you come to us and you have a dog or a cat, you're responsible for keeping them clean and tidying up after them and fed, but we won't turn you away because your dog isn't a registered service animal. We recognize that the ability to have your pet and that relationship with you is a huge psychological boost. So we do our best to accommodate everyone. As a shelter provider, we also believe in being really low barrier. I know I saw a question pop up a little while ago about substance use, and generally, we don't turn people away. Our sort of threshold is, are you able to take care of yourself? Are you able to handle the basic activities of getting yourself washed, fed, and to bed without being super disruptive? We don't permit substance use on site, but if you come home and you've had a couple beers and are a little tipsy, we will check in on you and make sure you're okay and let you crawl into bed, because we'd much rather you be somewhere safe and warm than camping out on the streets or in another unsafe situation. So that's kind of the quick and dirty about where we are at the Dolores Project, and how things are innovating and what we're trying to do in meeting the change situation as presented by COVID. So Meredith and other presenters, thank you for giving me a chance to talk us up a little bit.
Absolutely. Thank you, Robin. So we have 15 minutes to answer some questions, which thank you all so much for all of the questions you have posed. There have been a lot, and I'm glad to have my team who has been able to answer a lot of them, as well as the panelists in the chat. But we do have a list of questions that we want to get through live, because there was a number of questions kind of focusing on those same topics or something we thought you all should know. So the first one that, well, I'm going to save that one for last because it's the best one. For the safe outdoor parking, would you mind telling us, Kimberly, what happens when the weather is cold? What would happen in that circumstance for people who are staying there?
Yeah, it's a fantastic question, and we're just obviously navigating that here. We have been blessed to be partnering with churches and using their facilities and their lots. And right now, what we've been doing is providing ways for people to stay warm in their cars and also run their cars with heat. However, we're working on supplementary offers right now, such as staying in the community room. So all of the safe parking lots that we're securing and offering to people have a community room, showers, kitchen, bathroom, and a gathering space with internet. We also are presently applying for funding to have optional hotel stays for anybody that's in our parking lot when it gets real cold like it did last week. So honest answer is we're still navigating that. We don't have the resources to keep everybody as warm as we'd like, but we're pulling things together, making up new solutions.
Great, thank you so much. The next question we have is, how do we keep track of people experiencing homelessness? And this is probably for you, Jenna. How do we find people who are experiencing homelessness if they are being moved? And that is in relation to the camping ban.
Yes, thank you. I would say that is one of our greatest challenges and something we are continuing to work through. I don't have a straight answer. We just, we work in an amazing community with a lot of wonderful community partners. And so the Denver Street Outreach Collaborative is more than CCH. And so our health outreach team at CCH definitely works with within that model and gets referrals and information. Community, honestly, a lot of the referrals and finding where people are other community members of clients experiencing homelessness, right? It's like, hey, my buddy over here, you saw them for the wound, their camp got moved, they're here now. And so it's a lot of word on the street, trying to track, to follow that, but there's not a good system. And I think a lot of that's based on fear of repercussions.
Thank you. We have a few questions about funding and how these projects are funded. We do know that there is Denver Measure 2B, but if they're outside, well, first, do all of the projects fall within those funding sources, or are there other funding sources that help to pay for them? And especially funding sources outside of the Denver metro region. So anyone is fair game to answer that question, feel free.
I'm happy to chime in on that. So yes, the state and city and county of Denver are big funders of a lot of our service work, but we are really fortunate to have significant investment from private foundations. This includes things like the Anschutz Foundation, the Colorado Health Foundation, Caring for Denver Foundation, and a lot of private funders who haven't necessarily focused on housing insecurity in the past have made funding available in the past year, particularly because of the COVID pandemic, to provide additional housing dollars. We've also seen this year a significant uptick in our individual giving from just private citizens who are concerned, as well as from a lot of businesses that frankly had never given us the time of day when asking for money before, are now sending, sizable contributions because they're seeing the struggles that their employees, their friends, people that were customers that can't be anymore have experienced. So funding is pretty varied. And I think it shifts a little bit from organization to organization about what that mix looks like. But that's kind of the overarching way we provide our services.
Great, thank you. Does anyone else want to answer that funding question? Okay, then we will move on to a question for Cole and Dave specifically. Is there anyone in the City of Denver administration actively involved in promoting the success of the safe outdoor spaces? There's a lot of questions in this bucket, so we'll get through that one and then I'll chime into others.
We've worked in close partnership with the Mayor's Office and the Department of Housing Stability to advance this solution, as well as City Council. So last night, the Mayor's Administration, through the Department of Housing Stability, brought forward a contract that would fund 2 sites through the end of this year. And so we're grateful for that partnership. And we'd love to see more investment. The amount of funding that was provided will enable us to serve about 10% of the 2020 point in time count through this method. But my question is, what happens with the other 90%, and how are we making efforts to reach those that remain unsheltered? So I think that's a question that we ought to be holding as a city.
Yes, absolutely. And this next question kind of follows suit to that. Cole, are the sites that you have first come, first serve, and how does that work for people getting access to them?
So I kind of skipped over my slide about resident selection pretty quickly, but it's a multi-step process. We are not a walk-up site, so people can't walk up and get services. And part of that is because we wanted to make sure that we were having a positive impact on the neighborhood, and we didn't want to be a place that necessarily drew more people to camp in the surrounding area. And so we actually are doing outreach and identifying people through outreach that are interested in coming in. And then when we have openings, we go back to that list and bring people in. As we are bringing people into the site, we're also doing so with a lens to racial equity. We're acknowledging that people of color are disproportionately impacted by homelessness, and this is true in the unsheltered homelessness population as well. And so we're ensuring that the racial and ethnic makeup of the residents of our site is reflective of the population of people that are living in unsheltered homelessness. And so that's one of the ways that we are sort of filtering the residents as they're coming through.
Perfect. Thank you so much for that. So I know we kind of chatted a little bit about this. A number of you have mentioned the number of people who are experiencing homelessness in Denver and in Colorado. And one of the questions we have is, do we know why? Have we gotten down to the bottom of this? Because the 2019 to 2020 increase happened before COVID. So do we have any anecdotal stories, and even stories I imagine people would like to know, once COVID hit, what has been the experience of people who are now becoming homeless and coming to seek your services? Fair game for anyone, but don't make me call on you.
I'll be happy to. I'm fairly new at Hope, so I probably am not the best to speak on the overarching stats and trends, but I can attest to the fact that we have served an incredibly large amount of individuals that they were just 1 or 2 steps away from having trouble making their rent. And then you add in COVID hitting, and housing prices going up, and a whole series of other little things that happen just kind of put it over the edge. So in the Longmont community, we have served a lot of people who really aren't choosing homelessness as a lifestyle, but have found that they had 1 or 2 or 3 things happen that were just enough of a stressor that it put it over the edge. And fortunately, we were there to be friends with them in that process. With that as well, even though our demographic is not quite as broad a spectrum as Denver is, so while we are committed to diversity and inclusion, our demographic just doesn't spread as diversely as you may. Nonetheless, we have had many in our shelters and in our safe parking program who are falling within that marginalized and needing attention category. I know we had one individual who was an engineer at a very solid organization who came forward in his full identity as transgender, and kind of subsequently lost his job. And then in doing that, within a month, didn't have his lease renewed. And those were things that happened completely and directly related to him stepping forward with great courage in his own identity. So we are coming across some cases like that as well that we're giving very special attention to.
Thank you. Sorry, I lost my mouse for a second there. Does anyone else want to answer that question as well, of their anecdotal experiences of why we're seeing people needing to access these resources?
I could share a little anecdotal. I mean, across the nation, I think that there's multifaceted reasons, but in Denver, we are a growing city. We're fast growing. Our prices are going up. Income and equity aren't matching that. And so I think there's just this disconnect with resource availability. People are living in food deserts. They don't have access to healthy foods. They don't have access to be able to pay medical bills or family bills. There's, all sorts of health factors, of course, I have to think about, right, of past trauma. Not everyone has mental, experiences mental health, but that's our substance use, but there's definitely medical reasons for that as well. And so that disconnect between growing populations, lack of access to resources really enhances that. And I think COVID has highlighted that, right? It's something tangible that we can see. It's one incidence of, a virus that we've been able to see, but imagine that perpetuating, over the last several, hundreds of years in a similar fashion. And so we've seen many more people experiencing homelessness checking into our shelter services, our healthcare services, because they don't have the support, right? Maybe before they would be able to lean on and have someone being able to support them. And the difference between me and somebody living out on the streets right now, maybe is when I go through a tough time, I have a safety net, and that person doesn't.
Thank you. So I know we're rounding out. We have about 4 minutes left, but this is the most critical question for this audience, I believe. So here's where you probably want to take out your pen or take some notes, because this is where we need your help. So for all of the panelists, would you mind saying, how can people help? How can they get involved? What can they do to support your mission and vision for these innovative projects continuing in the future? And if each of you want to go ahead and add that in, I will happily let you take up the rest of the time.
I'll jump in. You could give us a follow on our Facebook page at Co-Village Co. That's kind of our best hub for keeping track of our projects. Hopefully in the next month or so, we'll be announcing that a new safe outdoor space is moving forward. And we're going to need people to get behind that project and advocate for that so that we can continue to offer those critical resources. We'll also be moving a safe outdoor space in the middle of the summer, and we hope to open a third tiny home village as well this year. So joining our Facebook page or our newsletter on our website are great ways to just get connected and stay in the loop for these projects as they're unfolding over the course of this year.
Yeah, and I'll just add, because Cole just shared, as it relates to safe outdoor space, we've had amazing volunteers, both from our church community, but from the larger community, that have made this project possible with bringing food along, donations, of course, and helping us in many ways. But, an ongoing need we have or our daytime shifts to be a volunteer. And so there are really simple, safe ways that all the people in this call, if you're interested and wanted to actually spend time at our safe outdoor space and volunteer, you can do that. And I put the link in the chat. I'll drop it in there again. But you can just sign up online to do that. Even if you just want to go and get more information, you can do that as well. We'd love to have you.
Perfect. Do Kimberly or Robin, do you want to add anything?
Yeah, much like Cole said, if you want to follow us on Facebook, we are just the Dolores Project, pretty easy to find. And starting next month, we'll also be launching a new podcast called Welcome Home. And so we'll be pushing that out on our website, which is thedoloresproject.org, as well as on Facebook. So we look forward to being able to share more stories about the work that we're doing and where we're collaborating with other agencies, and as well as sharing lived experiences. So thank you all for having us this evening.
Yeah, similarly, I put in the chat our website, hopeforlongmont.org. Our Facebook page is that as well. And we've tripled in less than a year everything that we're doing. So we are open to every form of help. It could come in the form of ideas. It could come in the form of donating space for another safe parking lot, for helping us with hot meals. We're in great need of hot meals for our Boulder Safe Lot, for donations. I have begun hosting panel discussions similar to this on very complex topics that are at the root of some of these issues as Americans. Join in, offer topics, be a panelist, attend with your questions. So we're kind of an open canvas right now with our level of growth, and I'm welcoming every type of support that's coming our way if we're able to do it. So thank you so much for having us.
I think from my perspective, you all are already doing it, right? You're attending these education and advocacy events. You're taking the initiative to learn, reduce stigma, and a lot of the health outreach is coming from that, right? A lack of resources, a lack of opportunities, traumatic experiences people are having, and not feeling like they're being treated like humans, as fellow humans. So I think you all are on the right track.
Thank you. And I think I just want to share my screen for 1 second, because I want to ask you to do one last thing. We have our virtual lobby day next week. Speaking of, it's actually 3 days, and it's 2 times in each of those time frames. So please, tomorrow I will send an email out that will include a recording of this event, as well as some ways that you can listen to different podcasts, read more about innovative approaches, and watch a TED Talk. So please do that further research and then sign up for one of our lobby day events, or sign up for all of our Facebook pages to follow all of the work that we are doing. The events that we have are on statewide legislation that is happening now. So this is the time to get active and participatory so that we can really make a difference. And these events will be, we're going to do some recording so we can record some testimony of people who will attend, and that will be very exciting. So please plan on joining us. There'll be a link to sign up in that email that I send out tomorrow morning. So again, thank you all, and hope to see you again at our next event, which will be on, I just moved my paper here, on March 24th, and that will be on advocating to end homelessness. So more things of ways you can get involved and things you can do to help. So thank you all. Have a good evening.